In the high-stakes world of cardiothoracic surgery, where life or death decisions unfold daily, it takes more than medical precision to succeed. It takes trust, communication, and teamwork. Dr. Jonathan Cunha, Chair of Cardiothoracic Surgery at Mayo Clinic Arizona, brings all three to the table, along with decades of expertise and a passion for mentorship. With a career spanning clinical innovation, surgical education, and leadership in lung transplantation, Dr. Jonathan Cunha exemplifies the kind of professional who redefines what it means to lead in medicine. His approach? Marrying technical skill with interpersonal finesse. We had the opportunity to speak with Dr. Cunha about what communication and collaboration look like in an environment where the stakes couldn't be higher. From managing conflict to building trust, here's what he had to say in our candid conversation. What is your philosophy or approach to communicating clearly and consistently in high-stakes or interdisciplinary environments? Be clear, be direct, explain why, say the same thing to each team, even if there is conflict. Communicate often and regularly. Every time you do this, you build on trust. And trust is key. How do you handle situations when communication breaks down or conflict arises between colleagues or teams? I reflect. What happened? Could I have done better? What was my part in this? Then, I take the time to listen. Assume the best intentions. Go back and clarify what happened from my perspective and work toward resolution. Most people want what is best for the team. It's easy to forget that in the moment. Give each other grace. Can you share a time when collaboration with another department, specialty, or colleague led to a better outcome for a patient or a key decision? Mayo Clinic is an amazing place for collaboration. The level of multidisciplinary teamwork is far beyond anything I've seen before. This is especially true in cancer care, cardiac care, and complex transplant cases. Collaborating with the teams across the 3 Mayo sites leads to incredible outcomes. It's hard to even believe it until you experience it. What do you do to make sure communication styles don't create confusion when working with different departments or professionals who may speak different professional languages? That's a great question. I tailor my communication based on the person. I try to know their expectations and how they best receive information. It's not one size fits all. It's about situational awareness. Are there communication tools or formats, email, calls, walk and talks, that you find most effective in your day-to-day leadership? You won't believe this, but we still use pagers. I like calls. Sometimes, walk and talks are face-to-face is most effective. Email can be good for information, but calls or direct communication are often better for urgent issues or nuanced discussions. How do you keep teams connected and aligned when some members are remote or working across different locations? I don't think anyone has this perfect. It's tough. We do frequent check-ins and sometimes send little things to include people, like snacks, meal delivery, or event invites. It's about the small touches that remind everyone they're part of the same team. What is your approach to giving and receiving feedback in a way that promotes improvement and maintains strong relationships? Feedback given in real time is always better, but you need to tailor your approach. Some people get offended easily, while others appreciate directness. You have to know your team and know how to coach them. The goal is always growth, not criticism. What communication challenges are unique to a surgical team, and how do you address them? Surgery is high stress, and sometimes people aren't at their best. But we need to be predictable, respectful, and clear, even under pressure. Clarity in the OR is essential, and when the team knows what to expect from each other, it reduces friction and errors. How do you ensure psychological safety within your team so that everyone feels comfortable sharing ideas or raising concerns? You have to model it. Admit when you're wrong, listen when someone has something to say, and always thank people for their input, even when it's critical. If people are afraid to speak up, things go wrong. What advice would you give to other healthcare leaders who want to improve communication and collaboration within their own teams? It all starts with trust. You build it by being consistent, by showing up, and by treating people with respect. Never underestimate the power of transparency. If your team trusts you, everything else becomes easier. What are the biggest communication lessons you've learned during your leadership journey in medicine? It's not just what you say, it's how you say it. I've learned that people remember tone and empathy more than they remember words. You could deliver the right information, but if you do it without sensitivity or understanding, it lands wrong. That has been a huge area of growth, opportunity, and emphasis for me. How do you promote interdisciplinary respect and collaboration among surgical teams, nursing staff, and administrative leaders? It starts with acknowledging the expertise each team brings. In the OR, everyone matters. From the scrub tech to the anesthesiologist to the circulating nurse, we all have a role. I make sure people feel seen and valued. That acknowledgement goes a long way. Can you describe a communication misstep you experienced and what it taught you about leadership? I once assumed a plan was understood because I'd explained it clearly to one group. I didn't realize the message hadn't reached the rest of the team. That caused a hiccup in patient care. Thankfully, nothing serious, but it was a wake-up call. Since then, I check and recheck communication chains. Clarity and repetition matter. Dr. Jonathan Cunha reflects the deep experience of someone who not only understands high-level strategy but also values human connection. Whether he's navigating a complex transplant procedure, mentoring future surgeons, or coordinating with colleagues across departments, his focus remains steady. People first, precision always. What sets Dr. Cunha apart is his rare blend of humility and excellence. He doesn't posture, he prepares. He doesn't manage from the top down, he leads from within. In doing so, he has built a culture that respects communication not as a formality but as a lifeline. In a world where technology and treatment options evolve daily, it's reassuring to know that the art of listening, learning, and leading with empathy is alive and well in the hands of experts like Dr. Cunha. We thank Dr. Jonathan Cunha for his time, candor, and the extraordinary work he continues to do in advancing not just cardiothoracic surgery but the culture of collaboration in medicine as a whole.